Hello, everybody. My name is Serena, and I'm one of the master's students in this class. I'm doing my graduate level presentation on food insecurity and nutrition during pregnancy. So just to introduce myself really quick, I'm one of the master's students in the class. I'm a master's candidate at UNLV in public health. I'm in the epidemiology and biostatistics track, and I have my certificate in infection prevention already. Perinatal and pediatric epi is my interest, and PA school is next for me. I'm doing a secondary analysis on data from the Pregnancy Risk Assessment Monitoring System, also known as the PRAMS, and I'm looking at physical activity changes during pregnancy and postpartum depression, but I am interested in neurodevelopment, nutrition, really anything that has to do with pregnancy or child development specifically. So let's get straight to it and start talking about nutrition during pregnancy. So among women, nutritional vulnerability becomes greatest in pregnancy. And one of the reasons for this is because the nutrition needs among women during pregnancy increase. They also increase in the period immediately after pregnancy. So we would see something like that with breastfeeding. And we know that poor nutrition during pregnancy is associated with adverse effects in both the mother and the child. So in the mother, some examples of some things that you may see include anemia, preeclampsia, hemorrhaging, and even potentially death. And we also know that not only does nutrition during pregnancy impact the child, but we know that it impacts the child or the fetus in development, in early childhood, and even later on into early childhood after birth. So it could affect the child years and years after birth. So this is a really serious issue to consider, not just for the health of the mother or the health of the baby during pregnancy or immediately after pregnancy, but also for the health of the child later on in pregnancy. And we'll also come to find that, if a mother or a family is at risk for being food insecure, for example, in pregnancy, that can also carry on, just like being um, having a higher likelihood of experiencing poor nutrition during pregnancy could be associated with higher risk for having poor nutrition later on, which that child is going to be exposed to as well. And what we see as far as the effects of poor nutrition during pregnancy on the child would include things like stillbirth, low birth weight, wasting, and even developmental delays. Okay, so moving on, what is good nutrition during pregnancy? Um, there's not 100% a clear answer on this, hence my but healthy eating, what is it really? It's a variety of food groups. It includes fruits and vegetables, bread and grains, your protein sources, and your dairy products. And that's according to the American Pregnancy Association. With fruits and vegetables, they recommend 2 to 4 servings of fruit daily, and then 4 or more servings of vegetables daily. 6 to 11 servings of bread and grains daily, which I did not know. That seems really high to me. 3 servings of protein daily, and then 4 servings of dairy products daily. What is good nutrition during pregnancy? Continued, we talked about the food, but also supplementing the healthy diet with micronutrients. These could include things very popularly that we talk about: folic acid, iron, and even things like calcium. And prenatal vitamins is actually a really good way to do this as a complement to nutrition. The key with prenatal vitamins, though, is that they need to be taken up to 3 months prior to conception. And the reason for this, and take folic acid, for example, folic acid as a needed micronutrient for proper development of the fetus is only going to be relevant in the early developmental stages, most of the time when a woman or a mother doesn't even know she's pregnant yet. So we would need that mother to take that supplement earlier on, or take that folic acid even before they become pregnant to catch that developmental period. Otherwise, they become at risk for not having enough folic acid and potentially putting the child at risk for developing spina bifida. So something to think about here, and this is just something that I like to consider and I like to think about, is should sexually active women of childbearing age be encouraged to take prenatal vitamins? Should all of them be? Because if we know this to be true, And we know prenatal vitamins just to be prenatal vitamins, right? It's still a vitamin and it's still healthy for a woman to consume. Should women of childbearing age that are sexually active be taking them? And should we be encouraging all of these women to take them? I think that's a good question to ask. So, moving on to food insecurity in the United States. Food insecurity is defined as a lack of consistent access to a nutritionally adequate and safe food needed for a healthy life. In this case, we're specifically talking about nutritionally adequate and safe food needed for pregnancy, right? And to meet the needs, the healthy life needs of both the mother and the child in pregnancy. And we know that food insecurity in general is a major public health problem, and it's a social health determinant affecting 10% or more of Americans every year. Women are disproportionately affected, as are specifically single mothers. And because of the COVID-19 pandemic, I wanted to add this in there because I feel like it's relevant to what we're talking to about right now, and just kind of speaking to terms of the world that we live in right now. So it's relevant for you all when you're watching this is the crisis of food insecurity has been exacerbated, and food insecurity is continuing to dramatically disproportionately affect racial and ethnic minority groups. And we're seeing these disparities worsen as a result of experiencing the COVID-19 pandemic. So, if we look at food insecurity specifically among pregnant women in the United States, we know that every 1 in 3 women in prenatal care this week, so women that are seeking out prenatal care, cannot afford the foods that are necessary for a healthy pregnancy. And I want to point out that this is specifically a statistic, right, that's pointing to women that are seeking out prenatal care. So that's not including all of the women and especially the women that may be at risk, right, for not being able to have access to these healthy foods. So that's important to consider and important to remember. So the problem is probably worse than this statistic, right? There's probably less than 1 in 3 women who cannot afford the foods that are necessary for a healthy pregnancy. And to add to that, women, again, as I mentioned in the last slide, are disproportionately affected, and this is especially true for single mothers. And so when we think about pregnancy, this is something that we need to keep in mind in the back of our head because food insecurity as a general problem, right, is already demonstrating that women and especially single mothers are at risk. So when we talk about nutrition during pregnancy, right, women are already an at-risk group for not having access to nutrition and nutritious food resources. And when we see pregnant single women, we really want to consider the potential effects that this could have, also with racial and ethnic minorities as well. So, with the potential effects of food insecurity among pregnant mothers, I looked at a qualitative study. It was published in 2019, and essentially what they did is they looked at 100 low-income Hispanic mothers and their children from a large hospital in New York City. And this was all actually from a larger cohort study that was looking at a childhood obesity intervention in New York City. But what I really want to point out here is that 35% of the women in the study reported experiencing marginal household food insecurity, and 32% reported experiencing household food insecurity. And really, what the gist is here, and what I really want to point out, is that mothers who experienced food insecurity did perceive that it affected their feeding practices, along with the quality and quantity of breast milk in early infancy following birth. And food insecure mothers also were found to engage in behaviors that were identified to be limiting healthy foods that tend to be more expensive. So foods that are like fruits or vegetables or meats that are a little bit more expensive but are healthy, we found these women to be limiting these foods. And so to kind of conclude, what I want to point out, just because I know I want to keep this presentation short, under 10 minutes, but what can we do to improve nutrition during pregnancy? Let's educate our medical professionals on the importance of nutrition during pregnancy and emphasize health equity for women, and especially for adolescents, like young women who may be getting pregnant, or racial and ethnic minorities. Screening for food insecurity in primary care, identifying at-risk families, connecting them to their resources, and this should be a part of health interventions among children. We want to improve access to government assistance programs and develop and improve community resources, things like initiatives and things like that, so that we can improve everybody's access, which is really their basic right to healthy foods. And with that being said, I just want to thank everybody who watched. I hope you enjoyed my presentation, and I hope it was nice and short and sweet and to the point, had a little bit of everything in there. So thank you, and please let me know if you have any questions for me.